call the Prince William-Manassas Regional Jail Board meeting to order. Good evening.
Good evening, sir.
Please. Could you please call her up?
Ms. Ashworth? Present. Ms. Rawson?
Here.
Reverend Bailey? Is not here. Ms. Clymer? Here. Ms. Guzman? Not here. Sheriff Hill?
Here.
Chief Keen?
Here.
Ms. Lennox? Here. Chief Newsom?
Here.
Ms. Smith? Here. Mr. Torres?
Here.
We have a quorum, sir.
Thank you, thank you. Any citizens here for any public comments?
We do have one, sir.
All right, is there waiting downstairs?
He's right out here in the lobby.
All right, could you have him please come in? Good evening, sir. Come on in.
How you doing?
Good. Welcome to the Prince William-Manassas Regional Jail Board meeting. All right, please introduce yourself. And
I'm Deacon Jim Vandervoort, just down the street at the Catholic Parish there, and one of these many as I can. My radar is just looking in for Christmas, and I didn't know if there was a cutoff date on whether or not there would be. We would plan for religious services on Christmas Day. I know it's a little ways down the road, but I want to at least get that on the radar so that we could track and see if I need to line some volunteers up.
Yeah, I will get with Captain West and we'll discuss that. There's a possibility. Anyone coming in will have to be vaccinated. And we're probably looking at some smaller groups than normal, but we'll take a look at it for you.
That's all
all right.
I have. Thank you.
Thank you for what you do for the inmates at
Yep.
the adult detention center.
The monitor's been going very well, which is a Friday night and a Sunday service.
Good, good.
The next jail board, I guess, is not going to be until 2022, right?
Yes, sir.
That's correct.
January.
That's all I have, sir. Happy holidays to everybody.
All right, sir.
Same here.
Thank you.
Happy
holidays.
Thank you.
Thank you
Thanks,
so
sir.
much.
All right, could I get a motion to approve the agenda for the November the 17th meeting, which is tonight?
Make a motion to approve the agenda.
Thank you, sir.
Second.
Are there any questions? All in favor?
Aye.
Thank you, thank you. Could I get a motion to approve the minutes at our regular meeting that was held on September the 15th?
Mr. Chairman,
2021?
oh, excuse me, I didn't mean to overspeak. There is one thing I wanted to note, not to necessarily correct the minutes, but that there's on page 12 at the top, it says that Mr. Packard and I were to draft a policy and bring it back to the next board meeting regarding inmate information and the whole issue of records. Once the board takes action on any matter, as it did with respect to the Commonwealth's motion at the last meeting, then it is an administrative matter for the superintendent to implement that policy. And my understanding is that Superintendent Melitas already has, and so we'll provide counsel to him as necessary. But we will not be bringing another policy back to the jail board separate from what the board's motions and resolutions adopted are.
Thank you.
So I just wanted to clarify that.
All right, thank you. All right, motion to approve the minutes of the regular meeting on 15th September 2021.
Make a motion to approve the minutes.
All right, sir.
Second.
There you go, second.
All right, any questions? All in favor?
Aye.
All right, thank you. Superintendent?
Yeah.
Yes, Superintendent, you may remove your mask while you're talking, that's
All
fine.
right. Thank you. Appreciate it. Before I get to my report, I have some news for you all. Major Lambert will be retiring on January 1st after 36 years of successful and dedicated career at the ADC. During her career, she would challenge herself while accepting different specialty positions such as inmate transportation and classification. And that's one thing we like to tell our new young staff, that the more you know about the agency, the better. And she has certainly done that. And her desire was to learn as much as she could about the agency. I know that. She rose through the ranks to the office of major. As a major, she oversaw the support services division, which includes training, HR, inmate records and property, intake and release, transportation, and court escort, and a big project of overseeing planning and construction of the phase 2 expansion, the transition phase. Another very important major project that Mandy was involved in was with Steve, as they were both appointed as the coordinators of the evidence-based decision-making policy team. Did y'all volunteer for that?
I think it was like voluntold.
That's a huge job in organizing with the criminal justice agencies and the judges, meeting every other month and so forth. But it was a very important project for this agency. Several years ago, we were at 50% recidivism rate. For every 2 inmates that got released, 1 came back. And now, sitting here today, we're about 21%. So it certainly is a public safety committee with judges and everyone that is involved with inmates are on that committee. So we certainly appreciate them for that. Mandy's going to be retiring with her husband, Bob, and she has her kids who have kids. She has grandkids. And one thing that Mandy does too that I admire for, we all times have parents to take care of, and she takes care of both her mom and dad that live with her down at Lake Anna. Poor Mandy down at Lake Anna. But anyway, we certainly wish her a great retirement and wish her well.
Before we, I'm gonna add a couple little things. I've been knowing Mandy since she was about 12. Right? And knew her family, watched her grow up and come into this profession. And there's one thing about Mandy that when I was superintendent that always stuck out. You know, sometimes people will walk by things and they don't see them. But it seemed that every time Mandy walked by something, she always saw it, which and brought it to someone's attention or corrected it when she saw it. Right? And of course, we already know that she is president of the American Jail Association, which is a big accomplishment and reflects on not only the adult detention center here to get us recognized nationally, but also on the Commonwealth of Virginia. She brings a lot to the table. So, Mandy, you're going to be missed. I know I'll be calling you every once in a while I got a couple of things I need to talk to you about. But you've been a big addition to the adult detention center, and you represented us well. She's also an expert witness too. She's been involved in a lot of cases too. So I remember when I first talked to her about getting more involved in classification, and she did. She got involved in classification and took off and just been done some extraordinary things to help our agency and other agencies as well too. So congratulations, man.
There you go.
All right, please let the record reflect that Ms. Guzman is present. Good evening. Good evening. All right, Superintendent.
All right, we can go over to page 14. Okay. If we look down to the second section, you can see our average daily population for the FY 2022, the first 4 months of the year at 527. Down to the next column as we go back for a year, back to November, looking at 564. Average agency inmate population. All right, down at the bottom, transfers to the state system. It was uptick in September of 25 and a downtick in October 21 of 2. That's been the lowest number we've had in a while. Commitments, 518, and a big increase in commitments in October of 578. However, when you look below that 578, releases were 579. 538 releases in September. process only by the ADC staff, 77 in September and 83 in October. So, transfers to the Department of Corrections, and we already talked about that. The Department of Corrections is out of compliance. We have 69 inmates who are sentenced to 3 years plus that are out of compliance. 3 of them are female. We're on page 15, the average daily population you see on the complex of 528. You can see the daily different counts there. And for October, 506 for the average daily population in October. Page 17, the historical data that we see. First 4 months of 527, and I can go all the way back to 1983 of 178. All right, on our objectives, our vacancies are up. Unfortunately, we have 54 vacant sworn and 10 vacant civilian positions. We're going to increase our testing dates and also numbers for testing. We'll probably move the testing into our roll call room, which we can bring in quite a few more, hopefully get up to 20 and 25 at a time, and try to speed up. We got quite a few people on our list that we can start putting through the process. So we're going to try to do a few different things to help out with that. Prison Rape Elimination Act, nothing to report. A lot of training in the last 2 months. 371 staff completed the cybersecurity training. That was mandatory through the county. 13 jail officers graduated from the Jail Officer Basic Academy, and I appreciate jail board members that came to that graduation. It was very good. Lieutenant Outland and Nurse Rotaru attended the Virginia Jail AJA Leadership Initiative. That's a collaborative effort between the American Jail Association and VARJ, Virginia Association of Regional Jails. It's a 1-week training, so we are, each time we're sending at least 2 staff down to that training. It's a very excellent training. 16 staff have completed peer support training. These peer supports will be the first contact that our staff members will make if they're in crisis. And we're looking forward to have a resilience person working out of the county that will be assisting us. It's a split position with the Sheriff's Department and us to use that person. So we need it here. It's very important for anytime there is a crisis, and they don't happen all the time, obviously, but when they do, the staff needs some assistance. Major Lambert and Captain DePoy attended the AJA Health and Wellness Summit. Sergeant Baker also, Officer Humansur in our training division also attended. Sergeant Baker attended the Virginia Gang Investigators Association conference. Okay, the main facility repair project's moving along. Half the building is closed. The project appears to be on time at this time. Quite an overhaul of those cell blocks, toilets, sinks, showers, bunks, tables, light fixtures, painting, electrical outlet areas and so forth, receptacles, so vent cleaning out and so forth, and quite a few more. So it is quite an extensive repair project, expensive also too. Evidence-based decision-making policy team, the opioid subcommittee conducted a cross-system mapping to identify gaps. ADC has begun to hand out Narcan for those inmates that are being released. It's under a grant. Community Services and GMU will begin providing peers to connect with inmates, opioid users that are quickly released. So they're catching them at a quick time so we can avoid overdoses. And OCJS will be piloting to implement a new risk assessment, and our staff will have some staff here that will be assisting with Steve on that too. Steve, how long is that process?
It's going to be about 16 to 18 months to implement. It's a lot of system work. It's very similar to EBDM, so there'll be a mapping of but specific to the pretrial end.
Okay, I got you. Good. COVID, one staff currently positive, 3 staff have been exposed. 70% of staff have received at least 1 vaccination, so our numbers are going up, which is good. Dr. Ansher from the health department has visited several roll calls here, not to call anyone out or anything, but just to discuss the benefits of the vaccinations. So she's been a big help there. 0 inmates that are positive, and 178 current inmates are fully vaccinated. Okay, we've got the graphs. It should be there with you. Quarterly graphs. Graph 1, as you look at it, it certainly reflects our low count of 506, which is the lowest in the last 3 years. So we've been looking at that. COVID has something to do with that also. Main building population, that's the building that's under the repair. So it's half closed. You see there are 100 inmates for October. The modular building, a slight uptick from 47 to 63 in October. That's mainly a programs building over there in the mod. Work release is very low. Our population has flipped in the way of custody levels. We have a lot more medium and max and less minimum, which is good because the medium and max should be in jail and maybe lesser offenses should not, but it's very hard to find people that are eligible for work release right now. The central building, you see those numbers up for both September and October because we're holding those inmates over here from the main building through the repair project. All right. And we talked about the transfers to the Department of Corrections in September 25, October 2. Manassas Complex versus the ADC. You see the commits there of 578 and the ADP of 506, which means a lot of people got released on the soon thereafter. Monthly wide, system wide, it's not much of a change there. Commits, you can see some of the example of an uptick there in the corner. All right, graph 10, which is a little busy, but it explains quite a few things. Actual population 506 for October. The central building has 66.2%, and that is because of the repair project. Slight uptick in the modular we talked about, and the main with 100. Operational capacity, 1 cell, 1 inmate. That's a good capacity to have, and you see the percentages there. System ADP versus Manassas ADP, slight decrease from July. And page 12 is the current system-wide average daily population. System, we call it system-wide, but we don't have inmates housed in other facilities like we used to, the farmhouse and so forth. We just still call it system-wide, overall count. And of course, the last page was the Mosley study, and COVID took a big chunk out of that over the last couple of years. And EBDM and a few other things for sure. Chairman, that's all I have.
Thank you, Superintendent. Any question for the superintendent on his report?
Oh, one other thing.
Yes.
I do have a couple comments. One other thing, we are doing GED with a Spanish-speaking instructor, so that is ongoing. And I do have, we got a few numbers here. Okay. And that has just recently started.
All right.
That's it.
Yes, Ms. Goodman?
Thank you, Mr. Chairman. If I can ask a question about the Narcan provided to inmates as they are being released. Is that something that is also available to the family members?
That could be. I mean, if someone gets released who has an opioid problem at home or something like that, that's where it can certainly be used.
Yeah, because, I mean, it's very unlikely they will be able to use it to themselves when they are going through a crisis. So it would be ideal, to provide that training and the Narcan itself to a family member that is a life that we could actually save.
Is it two, maybe?
We get two nasal Narcan.
So that's good.
But they have to go through a training in order to know how to use it.
They will.
The family member, right?
Well, I don't know about the family, but whoever gets out will go through the training.
And is there a possibility to provide it to one family member?
To provide
Because
training?
Not used. If I'm a drug user and if I'm going through an opioid crisis, there's no way that I can use it myself to save my life. It's more than likely the one person in their surrounding environment.
Well, yeah, there could be somebody there that can help them. Hopefully, a family member can, or their friends.
They have to go through a training, I believe, in order for them to get access to that.
Well, they do. I mean, the standing order is through the Virginia Department of Health. Anybody can walk into any pharmacy and purchase it, and the training is very minimal. We provide a lot more training, but they are given from the Virginia Department of Health a use sheet, how to use it, that they leave with the Narcan. But what we are finding, Ms. Guzman, is that the people that they typically surround themselves with are very in tune with how to use Narcan. It's like an Afrin spray. So as far as being able to train family members, we can't do that here because we're providing the training within the secure part of the facility. We don't have the capacity to do that outside of it. So family members are getting training through community services, things like that. But here at the jail, our goal was to provide them with the Narcan so that they could have it available and on them when they're released in the event that something happens in the community. Somebody most likely will know how to administer it.
A follow-up, Mr. Chairman. So when the person is released, do they get a discharge plan and that person is sent to the CSD? It's my
Most likely, there's already some level of connectivity if we've identified them with a substance use disorder. A lot of times this is a very quick turnaround, so we can't get them appointments because they're getting released too quickly. But most of the time, we provide them with access. We send them over to the MAP clinic run by George Mason University. We release them with their medication should we have ordered their Suboxone while they're here. So as far as connectivity, there's challenges and there's barriers because they're being released so quickly. This is just one other form of trying to reduce the number of overdose deaths in our community.
Thank you.
All right. Thank you.
One other thing, Mr. Chairman, during Hispanic Heritage Month, our kitchen staff prepared a great luncheon for the staff. The dining area was decorated in Hispanic heritage items such as flags from around the world. So it was a very good day.
Thank you. Thank you.
You're welcome.
All right.
That's it.
Any other questions for the superintendent? Thank you. Budget update.
Yes, sir.
Yeah, yes, it is.
Starting with the letter here, our commissary budget is, at the end of October, we are at about $2 million in the balance. The commissary budget, again, is slow to spend. Some of it is our programs ramping back up. Some of it is actually, we're having trouble getting billed for some of the services, such as the education. For some reason, we need to encourage people to send us the invoices for things like that. So we're working on that. The inmate account, those amounts are down due to the lower population. We had 67,000 in September, 83 in October. Our federal billing was only $338 and $253 in October. That was for the U.S. Marshals, just for inmates that come in and have a marshal's charge, and we were awaiting pickup. The only other thing I have on this is the payroll system that we have purchased. We just found out that the county has extended the implementation of the new payroll system, so ours is also having some challenges, so we're thankful but not sure what the implementation date is going to be at this point. On the next page, the expenditures are nothing really to report unless anyone has any questions. They're developing as expected. And then on the next page, the revenue budget, we anticipate being short of revenue again this year. Manassas actually the participation rate has increased. It's at 12.7% so far. This year, last year was 10.5, so we have seen an increase in that. And nothing really to report. Revenues are down, especially inmate revenues, but all revenues. So we're going to have to look at ways to see what we can do to increase. But nothing else to report unless anyone has any questions.
Thank you, Garrett. Any questions for Garrett concerning our budget? All right, thank you. Moving along to billboard member comments. I think I'm gonna start on this side and we'll move on. Okay. Let's go.
I already made my comments, Mr. Chairman, but thank you so much for the celebration of Hispanic Heritage Month, and also for following up for the DVD in the front. That's really great.
You're welcome.
Thank you. I'll start at the end.
No comments today.
Thank you. Thank you.
But, Mr. Chairman, I just want to congratulate Major Lambert and thank her. She's been an invaluable resource for my office, and I appreciate her service to the agency.
Steve.
Yeah, likewise, I'm not going to let this moment go by to tell Major Lambert that I appreciate her work together on evidence-based decision-making, but on a grander scale, it was really a great opportunity to work with you. You're so bright and strategic and collaborative and a consensus builder, and you really have helped move our local criminal justice system forward. You're going to be missed here greatly, and you're not going to be replaced. Someone will do your job, but I don't think anyone will be able to replace you, and we'll figure out how to get along without you. But you're going to be greatly missed, and your mark has been left here. So congratulations to you. I hope you have a great retirement.
Steve, could you talk a little bit about, I know your workload has increased with inmates being referred to your office, and talk to us a little bit about inmates that are on pretrial.
Well, what would you like to know? We have plenty of them. Because of COVID, and partly because of evidence-based decision-making, more people have been released to pretrial services. Our caseload has grown substantially in the last 6 or 7 years. It's doubled. It's leveled off because of the court system operating again, but it's still gone up about, I think, 11 or 12% just in the last year. So we're busy. Lots of people have been getting out. It's really been good because I think it's helped manage the jail population, which is what we aim to do in a safe manner. It's allowed the jail to have better capacity. It's allowed them to manage the COVID situation, I think, better. And I'm really happy and proud to report that our return to court rate and our recidivism rate of people committing offenses while under pretrial has remained about what it was before COVID, which means even though more people were released, it did not have a negative impact on public safety, which is really, really what we aim to do. On the flip side, on the probation side, because we do local probation, actually our numbers have dropped on that program because of a lot of the code changes that impacted who can get probation. So we're kind of monitoring that, and that's helped to balance our workload as well.
So thank you, Steve. Any questions for Steve concerning his program? All right, thank you. Chief.
Well, I'm not going to pass this opportunity up either. Some of you may not know that Mandy is actually a second generation of serving this community. Her father served this community with Manassas City Police until his retirement, and then went into work in our schools as well. So second generation, it's in her blood, it's in her heart. It's the caring for this community, growing up here, has that connection. Her husband also served, as you well know, Sheriff. So it's embedded into your roots. I'm not sure why we missed a generation. We got to get the next generation. Not going to happen. But Mandy, personal level, we came through this thing together. Thank you for your service. Thank your father and your mother as well, because we know that had a big part of it as well. So best of luck to you for your next phase. I do have something here. I have resolution number 2022-7, the approval of the purchase of a duty weapon. Let me put this on.
You can, sir.
Whereas Major Amanda Lambert will retire on January 1st, 2022 in good standing from the Prince William-Manassas Regional Adult Detention Center after 36 years of exemplary service, and whereas in honor of her dedicated years of service, and whereas in accordance with Virginia Code 5.1-148.3, purchase of handguns of certain officers allows Major Amanda Lambert to purchase her duty weapon. Now, therefore, it be resolved that the Prince William-Manassas Regional Jail Board does hereby approve Major Amanda Lambert to purchase her duty weapon.
That's a motion. Thank you. Second.
Second.
Any questions? All in favor?
Aye.
Thank you. Thank you so much, Steve.
Yes, sir.
Yes. All right, thank you. Chief.
Major Lambert, I in the room have probably worked with you the least of anyone else that's sitting here. I can tell you, you welcome me with open arms. I have some sense about the commitment it takes to do the work that you've done throughout your career for decades, to serve the community, to serve the folks that are unfortunately got themselves in this circumstance to be in this environment. And I just want to wish you and your family, your husband and the rest of your family, the very best that life has to offer in your well-deserved retirement. Congratulations.
Thank you, Chief. Yes, ma'am.
Just congratulations, Major Lambert. I wish I'd been able to work with you a little bit longer. I've enjoyed getting to know you just a little bit during the short time, and really making me wish that I hadn't changed jobs so many times so that I would be closer to where you are. And other than that, just it's great to see programs coming back to the jail, the GED, and the religious services, and sure it's help to everyone.
Thank you. Mr. Torres.
I would like again to congratulate Major Lambert on her retirement. I have also worked with you for a short period of time, but I started here with a very kind of hot and controversial issue, had to do with the 287G, and you provided a lot of good information and a neutral position that helped us get to a reasonable position on that, and I do appreciate a lot your work on that part, in getting us together and giving us a reasonable solution to it. And I also want to wish everybody here a happy Thanksgiving and a great holiday season, since we will not see each other until January. So be safe and be healthy, and the best for all of you.
All right, thank you, sir. Ms. Bennett?
I can't see Mandy, so I'm standing.
All right.
I started out in my relationship with Mandy.
You can remove your mask so we can hear
That'd be
you.
great.
That'd be fine.
That'd be
Thank you.
great. As a defense attorney, I've always been a defense attorney in the course of my relationship with Mandy, and it has often been contentious, and I would say it's maybe grown more contentious as times have changed and I've become the chief public defender. Having said that, I can't begin to account for what Mandy has done for Prince William County and for the criminal legal system of Prince William County. And that's because you have embraced collaboration in a way that models it for everybody else. Even when it's really hard and it's contentious, the professionalism that you have shown through all of this is a model for everybody that's going to come after you. I agree with Steve, you're irreplaceable. We'll live with it that you're leaving us, but it's not going to be easy for any of us. And Andy, just thank you for everything that you have helped me to do and for helping me see clearly what my job is and just for bringing the community together in all of this. Just thank you. And then just a couple of other things. By way of just sort of news, the Virginia Supreme Court approved a 7th judge for this for our circuit court. That was great news, and as of today, we received a letter that Senator Survell forwarded from our entire delegation to the governor asking for funding for that 7th judge to be in this coming budget. So it's actually looking pretty good that we may end up with a 7th Circuit Court judge in the coming legislative session, which would be, it's going to affect everything in terms of the way the criminal legal system and, frankly, all of the court system works. And we're looking forward to the Public Defender's Office, looking forward to joining several other Prince William County stakeholders in our system of criminal justice in lobbying, starting in January, getting down to Richmond and lobbying not only for our judges, but also on behalf of mental health funding, with an eye toward getting the crisis response center set up and some other priorities for EBDM and for our criminal legal system in general. And we're hoping to be a presence down there. And then the last thing is I do have a motion that I forwarded to everyone. I don't know if people got it. I have physical copies that I can get
I'll pass out.
Thank you so much. Just by way of context, in the last meeting, there was, in September, there was a motion brought regarding obtaining records, inmate records, and that was the Commonwealth motion.
Thank you.
All right.
You got it down there, all right.
The procedures and policy of jail with regard to Commonwealth's access to records. There was a lot of conversation. I participated in that via phone, and so this is my response in terms of the invitation that was sort of put out at that time that the defense bar could bring a motion that would allow us to get our own client records from the jail and asking the jail board to create a policy that would allow the defense bar to obtain records in a similar way without having to go through the subpoena process. And as you can see from the summary on the front, that is there are several reasons why that would be important. I'm happy to entertain any questions for anyone that has questions for me, and otherwise I would like to make this motion. Sure.
Of course, she makes a motion. Any questions?
Yeah.
Yes.
Colonel, Ms. Pandek said at the beginning she didn't get involved in the policy. You wrote it. Have you already written this policy that allows the Commonwealth attorney, or are we still in the progress of writing that policy? And if so, does it already have a resolution to her concerns?
We are using right now, the resolution from the last jail board meeting for the Commonwealth, that procedure. We're going to put it in our policy, but we have not written a policy for the public defenders.
Ms. Panda, you have any comments?
I do. I I apologize, Tracy, that I haven't talked to you about this in advance. I kind of was literally out of the country. But there are a couple things I just wanted to note that are a bit different than the resolution the board passed one meeting ago, 2 months ago, and then some particular aspects. In paragraph 2, the second whereas, there is an inclusion of the term number 12, medical records. And I want to note that because this resolution provides, as will, I think Tracy will indicate, and we would request that there will be a release from the client or somebody who's in a position to do that, that would not violate HIPAA. So that's acceptable. That is not in the resolution that was passed with respect to the Commonwealth because they can't get those records without going to the court because of HIPAA. So the medical records is different, and I just wanted to note that. The second thing is, and whereas number 4, this is a small thing, and just I think his or her probably should be the term their, THEIR, just to be consistent with language we should probably be using. The next whereas I do have a concern with, I think what you intended, Tracy, and I should make sure that you tell us this is the case. The summary you provided is the summary to the board, is the summary of your opinion why this motion should be passed. It's not intended to be a summary from the jail board. Okay, okay, just want to make that, I thought that was clear. But the fifth whereas, I believe may not be an appropriate, if the board is interested in entertaining this resolution, is probably not appropriate because the ADC right now, irrespective of where inmate records go, be they the Commonwealth or be they Defense Counsel, has separately charged with protecting the health and safety of inmates. And so I think whereas number 5 really is probably not something that would come from the jail board as a statement in its resolution. It may well be the type of thing that, again, is like your summary, Tracy, that is one reason why you want these records. So I would just mention that. The therefore provision, you will recall that in the resolution, as noted in whereas number 3, regarding the Commonwealth Attorney's Office, it says to obtain all non-privileged records. The therefore needs to consider and include also records that are not privileged. And there are two aspects of this. One of the aspects is I don't think it's going to be an issue of privilege as it might be in the Commonwealth's resolution of attorney-client privilege being the defense counsel and their client. However, there are among the records that are listed here, there are records that might be included that are privileged as between, let's say, my office as counsel for the ADC. That may appear in some of these files, and those would be privileged in a different way. And so I think, should the board decide to consider this, then it should have the caveat in there again of which are not privileged, because we're talking about a different kind of privilege that may exist. For example, if there are a matter related to an inmate in which there was a consultation required by the superintendent and us about a particular matter, that would be a different attorney-client privilege. It may be between the jail board and counsel on a privileged matter. So I don't think that was ever brought up as part of the discussion on the Commonwealth's motion. That motion, as I said, does have the reference to non-privileged records being pulled out of it. So I don't think there's the same issue. There are likely, and I leave it to the superintendent to talk about any administrative implications of either one of these motions. There may be other implications and protocols that, as we work with the superintendent on on an effective implementation of these policies, both the Commonwealth's one, which is in the early stage, obviously being done effective immediately as the superintendent has implemented that policy, but also now turning to the potential of defense counsel that we haven't yet sorted out what those implications might be. I suspect that the dynamic within the ADC regarding, dealing with all of these records is very different than it would have been when there were subpoenas that were required in order for the ADC to make a response, or even during that time period when, inconsistent with what was ADC policy, records were being given at the request of the Commonwealth. So I leave that as sort of a vague caveat. I don't know what they are, but I think as we go along in this, there is going to be a substantial amount of activity in the records department that has not been the case to date in terms of talking to the superintendent and having those discussions. So I pass that along, Mr. Chairman, to the board for what it's worth.
Can you ask for clarification on a couple things? Ms. Pandak, so first is more curiosity than anything else. Where within the 12 items, and I have absolutely no objection, let me say at the outset, to adding language, records which are not privileged to the now, therefore clause. But I'm curious, where would communications in an inmate's record, and maybe the jail staff would know that even better, where would that land in an inmate's file?
It possibly, I don't think it will be in the files, but I cannot tell you for sure it might not be, which is why I make that caveat. But let's say, for example, there in number 9, there was an issue with respect to inmate discipline and incident reports. And there was something that came out of that incident that had legal implications. There might well be a record, and I just want to make sure that, even though my perception is from talking to the superintendent that those records are segregated, the ones that might have our attorney-client, I don't know for sure that they aren't, so I want to make it clear that they're going to be certain privilege records.
No, that makes sense to me. And then you mentioned that there could be implications for implementation. Do you anticipate that there would be significant differences between the implications between the implementation of the Commonwealth's attorney's motion and the one that I'm making here today?
I think I'll let the superintendent address that first, because I think there are things that I was not even completely understanding with respect to some of these records and the releases that are made. Let me say it this way, to the police departments that may be relevant to this. In talking with him, I think that in an ideal world, and I'm not saying this to be delaying anything, but because I do understand why you might want to have parity with the Commonwealth, but that perhaps some of those discussions, as might well be had better in a small group and then brought back to the board, but that really is your call, not mine. I just think we are entering a different phase where the ADC is being brought more into what is the litigation phase, and will be, just because of the much larger perceived or actual access that's going to be occurring. And that hasn't traditionally been where the ADC has had a role. So I just, as I reflected on this, I don't want to sound paranoid by, as a lawyer, I'm always 360 paranoid. So I do perceive that there may be a different sort of impact on the ADC than there has been in the past.
Do you anticipate, if there's not parity, that there would be additional, in fact, litigation that's going to implicate the jail and the jail board if there is not parity?
I don't know the answer to that. I do think, again, and if I'd been at the last meeting, I've read and I've talked to my associate about this, but I do believe that different sort of uptick in access than what the ADC had leadership had intended to have in the past, and as I understood it, is going to have implications, which is different than simply having police officers having pretty direct access to the records, which has always been the case. So just, that jail board has decided, and so that's the policy, but I do anticipate that will be the case. So you're adding in probably more requests. That's what the parity does, if nothing else. It's more requests. Whether there becomes what I would say is a competition between the Commonwealth's Office and the Defense Counsel on the matter of inmate records remains to be seen. I don't know how that plays out. I don't know how it plays out in an individual representation because the court's role may be different than it would be on a subpoena.
Superintendent, do you have a comment?
Yeah, I have a comment on the potential workload. Are we talking about just the attorneys that work in Tracy's division, or are we talking about defense attorneys all throughout the county?
I think it has to be all defense attorneys.
And
I'll
that-
speak for
The
Tracy.
intent
Yeah,
is
that.
The
intent is that this is defense counsel. Now, 80% of that is going to be public defender's office, just by the nature of the way that works. But it's still, it should be, from my perspective as the public defender representative of the jail board, that it ought to be that defense counsel should have access to their own client records in the same way that the Commonwealth Attorney has access to.
Yeah, because we don't know at this time what that looks like for records or our one person who deals with the phone recording. So we'll have to keep an eye on that.
All right. Yes, sir.
I just have a question on, maybe superintendent will know the answer. What's going to be, or maybe your attorney, the burden on the ADC to verify that the inmate authorized the release? Because you're going to have a document with a signature, I would imagine. And how would you verify that?
You want to go first, Superintendent?
Well, we'd have to have some kind of release that will be in the folder that who's ever releasing information will have to have some kind of release there.
There was a very short period of time in 2018 in a case that I had that we were submitting a written letter request to the ADC that accompanied my client having signed off saying, I authorize this. And we just dropped off every month a letter saying, I'd like these records, and the package would be left at the front for us. So then it was just a matter of an inmate here was here, and he signed off on a release and he handed it off to the jail. I would anticipate, Chief Newsom, that we wouldn't, for example, be requiring notaries. I mean, if it comes in on attorney letterhead with a client's signature on it, I think the attorney's got the burden to, and has a legal obligation to make sure that legal ethical, correct, obligation to make sure that the person has signed it. But to require the ADC to do more in terms of verification would probably be very burdensome.
Just to clarify something, right now, defense attorneys do not have access to these records except if they're subpoenaed them. Is that correct?
That's correct.
Okay. So I guess that if you're interested in the records, you are doing subpoenas for those records on a regular basis.
Yes, that's what we do now.
So how would the burden increase, administrative burden, if right now people are subpoenaing those records and you have to work them up?
There are not that many subpoenas that candidly that come in. I don't know what the numbers are, but there are not that many subpoenas. I would say on the HIPAA records, the medical records, it's different. That we're not. I don't know that we're requiring a subpoena on those if we have a client's signature for the medical records.
Chairman Hill. Oftentimes the records come to the Commonwealth Attorney's Office and we either request 2 copies, one of which goes to the defense, or we copy documents that are necessary to turn over to the defense. So it's often my office that's bearing that burden of providing the information to the defense.
certainly, you know, when this came up at our last meeting, I wanted to wait until get Ms. Pandak, conflict attorney, and Ms. Lennox together and talk about this and see if we could resolve this without bringing it to the meeting, because in my opinion, we're getting away from our mission. Now we have to decide what the Commonwealth gets and what the defense attorney gets, and we're getting away from the mission of the adult detention center. You know, to me, instead of bringing a motion, my request is for you three to get together and decide on what's best for each agency, and just really inform us about what your opinion should be for how to get the records, because now we haven't decided what the Commonwealth gets and what the Public Defender's Office gets, and that's certainly, to me, getting away from the mission of this board. So if you're in agreement with that, we can.
Sure, I would have been in agreement with that in September, but that's not what the jail board decided to do in September.
Exactly.
They voted on this motion, and as a result, there are now, and frankly, I didn't object to that in principle at the time, although I voted no on it at the time because I didn't have time to look into it. But we're now in a place where that time has passed. I mean, we've already passed this with regard to the Commonwealth Attorney's access to these records, and I'm essentially, the language that is here is taken from the Commonwealth Attorney's motion. So we're not arguing about that part of it. We're asking essentially for the same things with the release and with the language changes that Ms. Pandak has identified as concerning to her as legal counsel for the ADC. And I don't think that there's anything complicated about it. If we hadn't voted in September, then sure, we could have sat down and hammered all this out. But that's not what happened. And I hope that this is recognized as just fairness. That's what I think this is just giving defense counsel access to their own clients' records.
Mr. Chairman,
Yes, ma'am.
to follow up on your comment, and now speaking as a delegate, I could tell you that I get multiple cases from my constituents who are incarcerated here about the access to the records, and I have to call the public defender, I have to call the Commonwealth attorney, I have to call the clerk of the court, and trying to, I think the goal, I know it's something new. In the past, we did not have a public defender's office, and now we do. But I think that it continues to be the goal of the board to improve the experience of while the inmate is here, because they are paying for a crime, but at the same time, they continue to be human beings, and they should be treated with dignity and respect. And making that file available so they can be defended on their case, I think is the right thing to do. And then to follow up on counsel, we were talking about the HIPAA being notarized. And so I would like to ask, is it only the HIPAA, or are you talking about the whole authorization to be notarized?
Oh, no, I wasn't talking about notarized at all. I said that probably there would not be a request for any notary. No, I'm sorry.
That's what I do for a living.
Yeah,
And
no,
when
I
there is a HIPAA
wasn't.
release authorization in any field, a HIPAA needs to be notarized. That's out of the norm.
Yeah, I don't know that we have necessarily been requiring that at the ADC. If there's usually it may come in with a notary on it, but the request often, if it's by somebody who's an attorney for someone, then there's likely to be a notary. If it's a direct letter, I don't know that we've been requiring notaries. I will turn that to Major Lambert or to the superintendent, but I don't think there's been a requirement. Usually if it's an inmate who's here, we have the ability to readily identify who they are, that they're the records, so.
Yeah, that's it, Mr. Chairman. For me, it's just, I'm looking at customer service, the time the people are spending here paying for a crime, and anything that we could do to make those records accessible to the Commonwealth attorney, to the public defender, so that we can enhance the experience that they're already living here. I think it's the right thing to do.
Chairman Hill,
Yes, sir.
I'm just a little bit confused because the last meeting that we had, the reason for denying the Commonwealth's attorney the access to the records was precisely an equity reason. That was your associate, that said to us that it was an equity reason why the Commonwealth's attorney should not have those records because the public defender didn't have them. So, if I heard correctly, that was what the thrust of that argument. Now you kind of, I sense like a swing from your office, from your advice in terms of, it is not really the equity issue now anymore, it's the burden that it would have, administrative burden that it would have on the jail. And so that's different from the equity argument. And based on that, we have to go back to the equity. What is equitable? If it's equitable for the Commonwealth attorney, it's equitable for them. And the burden, ADC has to deal with it. I mean, that's part of the mission is administering this jail, this regional jail. And sometimes to administer it correctly, you would have to increase your workload. That's what it is. Comes with the territory. So you'll do it the most efficient way. You'll use the resources that you have, or you may ask for more resources if you need them. But I was confused on that, because I think that your argument was equity, and now it's not.
Mr. Chairman, if I might address that, Mr. Chair. That is not, I was not arguing against this motion and saying something different than on equity. I wanted to point out to you that there were implications. So I'm not arguing against the motion. I wanted to go through with Ms. Lennox some of the issues that I think where it ought to be amended. I understand, but my point with respect to equity and what Mr. Packard from my office told you last time remains the same. It's just that I think that the board needs to understand that there is going to be a volume issue here. There was and is, I believe, an increased volume issue with changing the policy on the Commonwealth's attorney. That's just something you should know. That's not to say no, don't do it. It's just to say you need to appreciate that. And that has not been a role that, in either case, that the ADC has played before. I should say to Delegate Guzman, I must say, I do not think this is a customer service issue. And it should not be considered that. This is an issue with respect to records that are relevant to the litigation within which, for the most part, these inmates are involved. That's why the Commonwealth is interested in this. That's why the police departments, the sheriff's department have been interested in it. That's why the public defenders are interested in it. It should not be viewed as customer service because it very much is not that issue at all. And so I'm not trying to make it more than it is, but it is not that. And so I think one thing, Superintendent Miletus, that you need to speak to is that there are some records that perhaps are of a different ilk that appear to be in both, that are included in both of what the records that are in the whereas that need to be spoken to more specifically, that I think I wasn't aware of what was being made available to police departments in the past that might be different than would have been automatically made available or would be automatically made available now to defense counsel. And we need to, and that's something that I wasn't aware, and probably that when I suggested small group discussion, it was not to delay a fair consideration of what I think, not surprisingly, you raised back in September, but rather something that I was not as aware of as an incremental issue that perhaps is not yet ready for the whole board consideration. But that's more vague than not.
Yes, sir. Yes, Chief.
Ms. Ashworth, your actually argument was that you were a law enforcement agency and there should be entitled to the same documents that were already given to law enforcement because you are a law enforcement agency.
Correct.
Okay. That was the
Which
distinction.
that's a good way of saying it, Chief Keen, and it gets into details that but the public defenders and defense counsel are not arguably law enforcement agencies. So we are now moving to the issue from law enforcement agencies to what I think Ms. Lennox legitimately asked for. So I'm not saying no, is equal access to all of that.
That was my point. I'm not saying no either. It was not, to me, an equitable issue. It was distinguishing that they were part of the law enforcement community. They are not saying that they shouldn't get the records, but that was not the argument.
Mr. Chairman,
Yes, sir.
I am in the unusual position of being more confused than I was when we started this 2 months ago. And so I just have some questions. What I thought we did, maybe oversimplification 2 months ago, was reinstated a practice by codifying it in policy. And so the access that the Commonwealth Attorney's Office got, and we came to a consensus that the point that Chief Keen just made was a driving point, that the Commonwealth Attorney was a law enforcement agency. And so we reinstated a practice and codified it in policy. At the same time, the issue of equity was brought up. Chief Keen, I tend to agree with you. It was, for me, it wasn't an equity issue, but willing to provide a defense side, be it the public defender or some other attorneys, the access without having to go through a subpoena for records that they needed. And so my first point of confusion is, Attorney Pandig, is why do you project, or at least I hear you projecting, that this policy change would increase the volume of requests, since the defense attorneys can already get this through subpoena?
Because they no longer have to go through the process of seeking a subpoena from the court. It will be a question of maybe just simply writing a letter or filling out a form, and that is far easier.
So we hear that we also hear that there had been practice from the Commonwealth Attorney to request 2 copies of the information anyway. So I'm not sure I understand my second question, the projected increase in burden on administrative requirements for the ADC personnel.
I can't speak as to what the Commonwealth's Attorney does with the information it obtains. I can't speak to that. Some of it, the Commonwealth's Attorney is required to turn over, depending on whether it's exculpatory or for other reasons. Whether they are turning over everything that they get from the ADC, I do not know. So I'm not questioning it, I'm just saying that's not something that we know. And I don't even know if Ms. Lennox knows, because she doesn't know what they're asking for, so she wouldn't be able to measure that in many cases.
I guess lastly, to Delegate Guzman's point about we haven't had a public defender before now, it seems to me that because we now do, that there probably are administrative burdens that will exist in a variety of places that never existed before. And so I'm not sure I understand the what is coming across is over concern about an increased administrative burden.
Well, I'll let the superintendent address it further. I want to go back a little bit and say that it is not my understanding, and maybe this is a factual contention with Ms. Ashworth, but the policy of the ADC for some years has been not to provide records to the Commonwealth directly without a subpoena. They provide records quite frequently to police departments. So notwithstanding the fact that that was the policy, in fact, some records were being provided. Okay?
I get that, and that's why I
Okay,
made the
so I want to
comment.
make that, so how the
Practice being
volume, I
codified in
don't,
policy is what we
correct.
did.
The
At least that's what I was voting for.
some practice, but not authorized practice. The second point is that, yes, if there is not a requirement for a subpoena, then it is much easier to get the records, which makes it much more likely that requests are going to be made. It's just, getting a subpoena is a royal pain in the neck, candidly. So.
Come on.
Right. And maybe it will reduce the volume in the clerk's office, which may be a positive impact of this, and on the judges. But, they won't have to get a subpoena. There won't even necessarily be arguments if there's a question about whether, and we do know, Ms. Lennox, that one case long ago and far away before there was public defender's office, there was an argument, and there were over whether or not documents were going to be provided or not. Okay. So then that goes to the public defender's office. It has, my point on an increase in volume by automatically giving it to defense counsel has really no connection to the fact of whether or not we have a public defender's office, because it will be to defense counsel who asks.
Indeed.
They don't have to be working for Ms. Lennox in order to be able to ask. I would tell you that I don't think the jail board can say that we're only, and without litigation arising, that we're only giving information to those who work for the public defender's office. And if you happen to be a local attorney who kindly represents defendants, that you can't get it. So we're not going there.
Thank you for answering those questions. Mr. Chairman, I'd just like to say that at this point that as we consider this motion on the board, provided that there's nothing in here that is in violation of any Commonwealth law or Prince William-Manassas ordinance, that this is the right thing to do. And I, as I said 2 months ago, I'm strongly in favor of it, and I'm ready to vote.
Chairman, thank you. I want to address your point about the policy as you believe it to be, Ms. Pandek. I've been asking since July to have a copy of this policy. To my knowledge, the policy that required the Commonwealth to have a subpoena has never been written down. It's never been shown to me. We were always acting within the practice that's been in place since 2005. I had one question for Ms. Lennox, and then I had some thoughts about it. And before I ask you that question, I want to be clear that I think providing defense attorneys access to these records is a good thing, and I support it. My question, Ms. Lennox, do you have any information from any other detention centers that do this? And if so, what their policies are, like the procedure for how they do it?
So there are, I'm sorry, I don't have the names of the adult detention centers that do this. There are some that don't. Rappahannock Regional does not provide requests that way. There are two in Northern Virginia that do. I believe that they are Arlington and Alexandria, but I'm sorry, I don't have that listed here. I didn't look outside of the Northern Virginia area.
Do you know, can you inform the board about what the procedure is in Arlington?
It's a letter request to the ABC accompanied by a release signed by the client.
And it includes these 12 items?
I have no idea. It is my understanding, talking with other public defender's offices, is that it is what would typically be included in subpoena duces keeping for jail records in a comprehensive way, which is what this is. And that's from having obtained records from the ABC in the past, going through them all, naming them all, what the categories are, and then you produce a subpoena duces keeping to gather everything that you can. And that's what is encompassed in these 12 items.
Thank you. Are there any costs associated with that?
No, not that I'm aware of. Now, these are public defender's offices I'm talking to, and let me be absolutely clear. As a member of the jail board, I am asking that this should be a defense attorney's request, not a public defender request. It needs to be encompassing all defense attorneys. But the people that I've talked to about it are public defender offices. It could be the case that because they are state agencies, the jail is making a decision to not charge them because they are state agencies.
And as a state agency, the public defender's office, are they governed by the retention rules of the Library of Virginia?
Yeah.
Okay. One concern I had is that often defense attorneys get appointed, very often the PD's office, and then at some later point determines that they have a conflict. Should there be some requirement that the defense attorney perform a conflict check prior to getting these records, verifying that they don't have a conflict of interest? Because you can see you get inmate A's records and then you get inmate B's records and it turns out you have a conflict and you have to withdraw.
Sure.
You would
And
then be in
those
possession of
cases-
these.
So if we had to withdraw because we had a conflict, the records would go to new counsel, and there would be, if we have a conflict that requires us to get out of A's and B's cases, those records are just going to go to new counsel. So there's nothing that is going to be to the detriment of an inmate that we would obtain records that we then discover that we're conflicted out of.
Would it be acceptable that the defense attorney somehow acknowledges that they have in fact transferred the records to new attorney? Because sometimes what we're finding is new attorney comes in and says, I want these records, at least from the Commonwealth Attorney's Office, and we say we've given them to attorney number one, and they say, well, we don't have them anymore, we don't. So we have to reproduce them, and I'm concerned that the detention center will get multiple requests for the same records. Can you envision a mechanism in which the defense is saying, we receive these and we agree that we will forward them to new counsel if we are substituted out, and some mechanism where you could verify that that's been done?
So the only reason why that seems unnecessary to me is because we have an ethical obligation to hand over a file. Like, as soon as we're substituted out, that file doesn't belong to us. And so we're in violation of the rules of professional conduct if we do not hand a file off to the next counsel. And so there is the protection is already in place. If we don't hand off a physical, we don't hand off the documents in the file, we're in violation of the ethics rules. And they're very clear about that. There's really not any wiggle room, unless, as you well know, if there is a dissemination agreement that prevents you from in some way of transferring things, then yeah, there can be an inability to hand things off, but otherwise the ethics rules are completely clear about this.
Do you have any issue with a procedure which would somehow notify the Commonwealth Attorney's Office that these items have been turned over to you so that we don't have to duplicate the effort and produce the same documents that you've gotten?
I will tell you that the only time that, and this is granted one attorney's experience, although now it's one attorney that governs 22 attorneys since January, is that the times that we get documents from the jail about the jail's documents from the Commonwealth's attorney is when they're Brady materials, in which case that's the Commonwealth needs to hand that over independently as Brady materials, and not, it shouldn't, we can't say to you, we already have those jail records, so don't hand them over if they're Brady. You have to, as you know, you have to assess whether they're Brady and hand them over, and that's really a separate calculation. And we can't release you from the obligation of determining what's Brady and handing it over.
So I guess
Other things, I don't really get those from the Commonwealth Attorney's Office. I'm not getting records randomly that I haven't made Brady requests for.
So I guess my question was, do you object to a procedure in which The ADC says we've turned over all the jail calls from January 1 to June 30th, all the recorded inmate jail calls to the defense, so that we are aware that you have it, so we don't duplicate it.
That's an additional burden that you're now giving to the ADC to indicate to the Commonwealth that defense counsel has asked for records and they have been turned over.
Not if there's a carbon copy form. I assume the jail is going to keep
I
track
don't know
of the
that-
records that they're going to turn
I
over.
don't know that we would be necessarily doing that. We would just simply verify. I don't know. Do you keep a record of it, Superintendent?
Of where they went?
Of where they went and who it went to?
Yes.
Okay, but the question then becomes whether it would be understood by this policy that when either the Commonwealth asked for it or the defense counsel asked for it, that automatically a copy was sent to the Commonwealth or the defendant. That begins to put a burden on the ADC to broker the distribution of the records.
Is the Commonwealth suggesting that if the Commonwealth requests records on a defendant that is the person who's represented by counsel at the time, that you would notify defense counsel that you obtained their records from the agency?
No, that if the defense requests records from the ADC and the ADC says we've turned over these 5 records, we would just get a CC on that, so that not duplicating the records, obviously, but just so that we have an understanding of what's in your possession already, so we don't duplicate it.
I understand. Like I said, I don't think that is appropriate in this.
This is what I was talking about. If we was in a meeting, they could talk about this. And Ms. Payne, answer this question for me. What would be the benefits of seeking a court order of turning over records to the Commonwealth Attorney and the defense? What would be the benefits of that?
Well, it certainly would give clarity.
And
whether or not the court wants to get
turn over, correct?
Yeah, whether or not I think Sheriff Hill, it would give clarity to the ADC.
Mm-hmm.
Whether or not the judges want to get involved in that in a global way, as opposed to saying we'll deal with each subpoena request as it comes to us, I don't know the answer to that. I have not had any discussion with any of the judges about this matter.
You think that would be an option that we should look at?
I think it could be explored. That's up to the board as to whether you want me to do that. But certainly I have no problem talking to the chief judge about it.
I'd like to have the motion heard by the board. We can pursue that as a backstop to the jail board's decision today.
All right, Mrs. Lennox, you can read your motion.
I'm going to read it with modifications that Ms. Pandak referenced before. I'm sorry, beg your pardon. Do I need to read the in re part of it or just the whereas part?
I think just the whereas.
Okay. So whereas the Prince William County Manassas Adult Detention Center maintains certain records and recordings of the inmates detained herein, and whereas the records and recordings that are the subject of this motion include, but are not limited to, the following information: 1, recorded inmate telephone calls; 2, recorded inmate text messages; 3, recorded inmate tablet messages; 4, recorded video inmate visits; 5, booking photos; 6, visitor logs; 7, copies of inmate non-legal mail; 8, intercepted written communications between inmates; 9, inmate discipline records and incident reports; 10, inmate housing records; 11, inmate classification records; and 12, medical records. And whereas in September 2021, the Prince William-Manassas Adult Detention Center granted access to the Office of the Commonwealth's Attorney to obtain all non-privileged records and communications, including inmate medical records, without a subpoena, and...
Excuse me, excluding, I think.
I'm going to exclude the 4th one.
Okay.
No, I'm sorry.
No, you read including inmate medical records, and I think you...
Excluding
it was
inmate
excluded. I
medical
just want to make
records.
sure,
Thank you for the clarification.
so we don't have to fix it in the
Yes,
minutes.
ma'am. without a subpoena, and whereas the information contained within the record and the recordings that are the subject of this motion is often of great assistance to the inmate and their attorney in assuring the safety of the inmate, locating suitable alternatives to incarceration and preparation for trial, and we're going to strike the fifth whereas clause. Now, therefore, be it hereby resolved that any inmate's attorney or a member of that attorney's office shall be granted access upon presentation of a release signed by the inmate to the records and recordings, excepting those records which are privileged, described in this motion by requesting the same from the designated employee of the Prince William-Manassas Regional Adult Detention Center, and shall be provided the same forthwith and without delay.
You heard Ms. Leonard's motion. Could I get a second?
Second.
Any questions?
Can we, because it doesn't address any future dissemination of it or retention, I understand you're governed by the Library of Virginia, but private attorneys are not. Can we maybe amend it to ask the ADC to develop a procedure for implementing the ability for defense attorneys to request and obtain records? Is that an amendment to the motion?
As to what amendment you're suggesting. Or are you suggesting that are you suggesting that the jail board direct the ADC to develop such a policy? That's not a part of this motion.
Right, that addresses some of the concerns that have been brought up.
I don't understand why we can't just ask the administration here to seek those solutions after we've ordered that this should take place.
Because I think it's different. The defense has a different obligation, different requirements. They have to zealously represent clients. They have, as you said, this property becomes the property of the inmate if you're to withdraw from the matter. There may be things that, get further disseminated that we aren't anticipating right now. And so, I think that I'm all for making access to this easier for the defense and by doing it by letter, but I think we have to take into account that there are, phone calls with victims, there are messages with other members of the community, and if other detention centers do this, they probably have policies and procedures in place that we could adopt pretty easily.
Every jail call, the very first thing that's said is, this is being recorded. And so people that are talking on the jail calls know that they're being recorded. So they don't have an expectation of privacy in those calls. And this is not something that when you do a subpoena ducis tecum in court, that it's raised that people, that the court or the Commonwealth's attorney or anybody else is asking for non-dissemination. I think that this is a red herring. I think this is a problem, and this is a solution in search of a problem. This is not something that we have any previous experience that dissemination of subpoenaed jail records has ever been utilized in a way that is destructive or problematic. I think we should vote on the motion as it is.
But the subpoena ducis tecum requires counsel to certify that they believe the material is relevant to their court case. And this is just saying everything is available.
It's an attorney who is an agent of the client that is incarcerated turning to the ADC and saying, my client is authorizing me to obtain this information in the course of litigation. Now, I can't get it just because somebody who's outside the jail hires me to come in and ask for this. This is me as an agent of this individual who's incarcerated asking for the records that they that documents their stay within the jail for purposes of litigation that we're engaging in over some criminal charge that's been placed against them. I think I would just ask the vote to continue.
Right. It's obvious that you all have some disagreements on this motion. Any other comments from any of the board members?
Maybe the solution to that is just to vote on the motion and then ask the jail board to develop a procedure for it. And if the procedure is to the like or dislike of members, then we can discuss that procedure later on another day. But we don't have to just shoot down the motion just because the procedure is not there right now. Because I think that this PAN Act can work out a procedure with Colonel Meletis and give us a reasonable thing that is reasonable for everybody, for the defense counsel, and it addresses your concerns. But we can, if we just wait for the procedure to be inside a motion, then that's not going to happen, and then there's going to be no access to records for the defense counsel, and that was not what we decided in the previous cases. And we cannot backtrack from what we decided on the last meeting.
Mr. Chairman, if I might, I think I would have to differ a little bit with Mr. Torres, although I do concur with him that apparently the message that was sent at the last meeting was that Ms. Lennox could certainly bring this resolution and it was anticipated. I think, and Superintendent, again, you can stop me if I'm wrong. This resolution would send, and if the issue is one of parity and equity, then the defense counsel would get whatever within the scope of these documents that the Commonwealth's attorney gets, if they, but it would be the same scope, the same type of documents. I do not believe that it is within the reasonable capacity of the ADC, putting aside just cost, to sort out and try to broker the dissemination of records. Those types of issues are routinely done in the context of subpoenas, and the court may say either these documents are being provided but they're under seal, or these documents be provided and counsel has to make representations, as Ms. Lennox has indicated, as to where they go. What the jail board is saying with respect to parity, with respect to documents, is you get them. We're not going to patrol, correct me if I'm wrong, Superintendent, because sometimes I get on a roll, that the ADC is not going to try to patrol where the records go. If they come in with a request from defense counsel or someone in their office, in writing, I think the ADC might have a form or would say this is what the writing we require. It wouldn't be anything particularly complicated, because again, our point is simply, we're simply going to be, if the board says to do this, turning over the records. That, as Ms. Lennox has said, it's their ethical responsibility as to what they do with them. They're not going to have to come to the ADC and say, we want these records in order to have this particular purpose for them, which they might have to do in a subpoena. It's going to be more like a quote-unquote Freedom of Information Act request. They provide the request and we turn it over, and there won't be exclusions except the privileged ones. So I don't think that it is necessarily fair to say we're going to adopt this procedure which says certain things and then say, well, broker between the Commonwealth Attorney's Office and the defense counsel later what defense counsel gets to do with the records. I just don't think that that's feasible, and I don't think you're gonna find that the ADC is stymied, because that's not the role we play. If your policy is we turn them over, then they will turn them over. We're not going to say, what are you going to do with them, and make sure you give them back to us, or make sure you give them to somebody else. Just for
clarity, that's what you're asking for, is that you give your office the same as we give the common attorney's office, basically.
Yes.
Okay. All right. Any other comments?
Mr. Chairman,
Yes, ma'am.
just for clarification purposes, as I misspoke earlier and said customer service instead of inmate service. But what I meant is that when an inmate is in the hands of the public defender, it's a client, and let's don't forget that while these inmates are reclaimers, they're continuing to have constitutional rights. And the constitutional rights are for their health and safety to be protected. When we're talking about their records to be released to either the public defender's office or to the Commonwealth Attorney's office, that could be a death or life situation. And I have seen inmates that happened here. Thank you, Mr. Chair.
Thank you, ma'am. All right. Any other comments? Call the roll.
Ms. Ashworth,
Can you pass over me?
Mr. Austin,
Yes.
Reverend Bailey,
Aye.
Ms. Clymer,
Aye.
Ms. Goodman,
Aye.
Sheriff Hill,
Yes.
Chief Keen,
Yes.
Ms. Lennox,
Aye.
Chief Newsom,
Yes.
Ms. Smith,
Aye.
Mr. Torres,
Aye.
Ms. Ashworth, back to you.
Aye.
All votes.
Thank you.
Yes.
Thank you. All right. I have one other issue that I need to bring to the board, and that is the OAR contract that we had to provide inmate services. That company did not live up to the terms of the contract, and the Adult Detention Center has worked with the county to get another vendor to come in to provide the services to the inmates. I have a copy of that contract. If board members would like to look at this contract, it's reviewed by the county. The Adult Detention Center staff is in agreement with the new contract. If the board will authorize me to sign that contract and we move forward, we can do that, or we can pass it out and we can discuss it.
Mr. Chair, question, so there's a new provider that this is?
Yes, yes. Mm-hmm.
Is it appropriate to ask what items in the contract OAR failed to live up to?
Yeah, Superintendent.
Yeah, they're mainly concerned with reentry services, anger management. They do it also. They also have Spanish speakers that come in, behavior modification, how not to be a criminal anymore. These kind of things. Those reentry programs that they connect them into the community. If someone has a certain issue, maybe some drug addiction, well, maybe when they get in the community, they can connect them with those kind of people. It's the same thing we've been doing for quite some time.
I'm sorry, Superintendent, so OAR failed to deliver on those?
They had a hard time showing up.
Okay.
Yes, sir. Not to be rude or anything.
And who's the new
Mr. Chair,
vendor?
if you don't mind,
The new vendor is being awarded to GEO Reentry Services.
Yes, sir.
Mr. Chairman, just because you're going to vote on it, you might really pass around that so everybody has a copy and can see it. Then everybody will be clear on what they voted on.
Sheriff, to clarify, Geo was, because I was on the committee that picked OAR, and I think Geo was the number two.
Was it number two?
I believe so. I believe so.
They were number 2 at the last RFP.
So it was from the RFP.
Yes,
So everyone knows
that's
that.
true. Good point.
I have 2 copies. If somebody wants
Yeah.
one.
They gave me one already.
They gave you one already?
Yeah, before you got here, you need to move fast.
So they have not started services yet, or they have?
No, I don't think they started yet. No.
Do they need a contract?
Yes.
So you need a motion.
Yes, everyone needs to take a look at it first, because we need to vote on it, because we need those services to start immediately.
Mr. Chair, I think I have one more question. Oh, was it OAR, aren't they a not-for-profit company? Yes.
Yes, they're they are a not-for-profit.
Is GEO a not-for-profit as well? I'm just curious.
They're not.
They're not?
They're not. No, they're a corporation.
Okay, thank you.
Yes, Ms.
I see that the company is located in Florida. They have local staff. Will they be providing these services in person?
Yes, they will be.
Are they, a follow-up question, are they familiar with the local community? Have their staff,
Are they familiar with the local community?
have their staff been working on these issues in the community?
My belief is they're hiring staff in the community. Yes. Also, one very important thing is life skills that they will be teaching also, and post-release checkups also.
So,
What's fringe, 22%?
Ma'am?
What is fringe?
Superintendent?
The cost proposal, fringe.
Community benefits for employees.
Okay.
Superintendent, I see that the amount of the initial contract exceeds what has been budgeted for these services. Is this, am I reading that wrong? On our budget report today, the remaining budget was $238,600, and then this contract is for $289,295. Is it because of the way the year falls, or are we going to have a shortfall in the budget on that line item?
My understanding was that they accepted the terms of the prior, so I'll have to check into that. I did not.
It does show that the prior, well, that the budget's $290,947, but that we've already paid out $53,000 of that.
Yes.
Carol, correct me if I'm wrong now, the fund for this particular project comes out of the inmate account, and it's not taxpayers' dollar in our budget.
It does come from the
That's
commissary.
correct. So this is not, this is the budget out of the inmate account.
So what happens if there's a shortfall in that account? How is it absorbed?
Most likely, we would come to the board with a resolution to amend the budget for that amount.
Okay.
What we found in the past is that even with OAR, they generally did not spend the amount that was budgeted. They provide invoices, so it may, although the budget states that we generally spend less.
So it's more like a not to exceed amount?
Yes.
Okay, thank you.
Any other questions from Carol and the staff concerning the contract agreement?
I heard it was number 2.
They were number 2 when they went through the process. OAR was number 1, and this company was number 2. And I assume it was 3, you on the committees?
I was on the committee. I'm not sure. I can't remember who else it was. I'm sorry. It's been a while.
They've been Rod.
Number 2.
Yeah.
Right.
And what happened to number 1?
Number 1 didn't fulfill the agreements in the contract. And what superintendent said, they failed to show up to perform the services.
Mr. Chairman, the committee is recommending this contract to you, to the board.
Well, they were the number 2, so I mean, they were capable.
Just
of,
talk about a committee. So I guess that a committee look at the different vendors.
Yes,
And,
it was a normal procurement process,
Okay.
and there was a group. I was the one from the board, and I think it was Major Osborne was on it, and someone else too. It's been a while. It's been a couple of years since we did the last review of the contracts, and this was the number 2 company.
Follow up, Mr. Chairman. Since Mr. Austin was in that committee, is this the same organization that right now is handling the state of the correctional facility at Lawrenceville?
I don't know that. They do run. I do know this company does run private facilities. I do know that they do, but I don't know if they run that one or not.
And is there a reason why we subcontract this service instead of absorbing it through the jail? Like, what do we make this, just to understand the process?
Well,
What would be the differences between you hiring yourself for reentry services instead of going through jail? Or to hire a subcontractor?
they are providing a lot of services, and it's quite a bit. that would be quite an undertaking to bring on employees and so forth to do that. We certainly couldn't do it with existing staff.
And I think this is more of a cost-effective way of providing services to our inmates. Probably, we started doing this probably about 20 years ago, and we had one of our officers that retired, and he started inmate services, and he did a very good job. And of course, about 4 or 5 years down there, we contracted with him to provide services, and of course that went away. And these services, of course, superintendent outlined some of the services they provide. And of course, we probably started out providing about 5, and now we're up to about 25 that we provide.
Yeah.
So, and my concern is, since OR has not shown up, provided, we have not done anything in the last, 6, 7 months?
Well, when COVID hit, they certainly didn't show up much, and it was hit or miss when they would come in and so forth. And the county took a good look at it and sent them a cure letter that they didn't want to follow. So that's where
And
we
it's part of the process, because usually, when there is a request to be for a proposal, is references included as part of the process as well?
Oh, sure.
Yeah.
And also, we have different buildings too that they have to take care of also. It's just not coming into one building and doing the programs. They're all over this complex.
Yes, ma'am.
Sure. So to address Ms. Guzman's, I think, concern, I know where you're coming from. I will say GEO does run Lawrenceville. That is the company that underlines Lawrenceville. And I do have, I'm sympathetic to the concern. I have some concerns about, private entities running detention facilities. And I think there's tons of problems with this. Having said that, I also want to, I think that the board could decide that we have some concerns about supporting that private supply of both, not just running jails, because that's not here, but providing supplies or services to our jail. I want to give the folks that did the search for the replacement for OAR all the credit for finding the most cost-effective, or what you thought was going to be providing the appropriate level of services for an appropriate amount of money. And granted, when you go into that, I have no doubt that you found the organization that would do that. But I'm sympathetic to the concern with having somebody like you providing those services. I don't have a thought beyond that because this is coming up so fast. I also am sympathetic to the fact that you need to get this restarted. You want reentry to get restarted as quickly as you can. And I want you to get, we all do. So I don't know what to say beyond that. I get the concern.
All right, could we have a motion to approve, and which side?
Mr. Chair, before that, just one question. Do we have a way of getting out of this contract for non-performance, and if they do the same thing as?
Yes,
Yeah.
yes, the purchase.
Because I think that takes care of
Right.
most of the thing. If they don't perform to
They
standards,
don't perform, we get rid of them. Yes. So I have a motion to approve the contract for providing inmate services with GEO Entry Services.
So moved.
So moved.
Second.
Thank you. Second.
Second.
Any questions? Could you call the roll, please?
Ms. Ashworth?
Yes.
Mr. Austin?
Yes.
Reverend Bailey?
Yes.
Ms. Clymer?
Yes.
Ms. Guzman?
No.
Sheriff Hill?
Yes.
Chief Keen?
Yes.
Ms. Lennox?
Yes.
Chief Newsham?
Yes.
Ms. Smith?
Yes.
Mr. Torres?
yes.
All but one vote yes.
Thank you. Motion passes. Board members, please have a safe holiday. Enjoy the holiday. Enjoy your family. And now I need a motion to adjourn.
So moved.
Second.
Any questions?
Me too.
All in favor?
Aye.
Thank you.
And they can-
Yes.
All right, Chief.
I'm coming.
Have a
I'm
great
going,
Thanksgiving.
yeah, you know, man, you know, those are big games, those are big games.
No, I had,
I
I
see like
had, yeah, I know, oh, adjournment, I'm sorry,